Across health and care, an overwhelming number of staff are dedicated to working together to ensure everyone receives the best possible quality of care according to their needs. And it's recognised that we do incredible work saving and improving lives. But there are times when things go wrong. And when this happens, it's vital that we reflect, update our knowledge and do better.
In 2016, Oliver McGowan died following a severe reaction to antipsychotic medication. When given this medication, he wasn't mentally ill. He was, as an autistic person with a learning disability, reacting to an overwhelming and highly stressful situation.
An independent learning disability and mortality review found that the procedures that were followed didn't work for him and that his death was avoidable.
The reviewers found that key warnings from Oliver, his medical notes, and his family were ignored.
And that if staff had a better understanding of autism and learning disability, they could have made some simple, reasonable adjustments to his care, which could have saved his life.
Oliver was 18 years old.
His was one of many hundreds of premature deaths of people with a learning disability and autistic people that happen every year.
This doesn't include unreported deaths, near misses, or the trauma of misdiagnosis over medication, unnecessary restraint and exclusion, which autistic people and people with a learning disability face every day.
The Health and Care Act now states that regulated service providers must make sure that all health and care staff have appropriate learning disability and autism training.
The Oliver McGowan mandatory training on learning disability and autism is the government's preferred and recommended training.
It has been designed to help employers meet their legal duties. It is nationally recognised, transferable from employer to employer, and represents the standards for the code of practice.
At its core is the principle of nothing about us without us. So it has been co-developed, co-trialed and evaluated, and is co-delivered by autistic people and people with a learning disability who are paid for their time.
Far more than a box-ticking exercise, Oliver's training represents the vital first step on an important journey towards getting things right for people the first time.
And creating a culture where everyone is listened to, respected, and cared for in a way that works for them.
While there are tragedies in our past that we can never put right, by moving forward with learning, we can do our best to make sure they're playing no part in our future.
We all have the ability to make a difference
in changing culture, hearts and minds. So, whatever your role,
we need you to take action now
by committing to and completing the Oliver McGowan mandatory training on learning disability and autism.